HIV AIDS. AIDS is an infectious and potentially fatal disorder that weakens the immune system. HIV is the pathogen that causes AIDS. HIV-positive people can infect others even if they are asymptomatic. HIV/AIDS is a pandemic. 34 million are infected per the World Health Organization. It occurs most often in homosexual men, IV drug users, heterosexual women, and healthcare workers. The important thing, though, is that mortality is declining. There are two subtypes of HIV. We have HIV-1, which mutates easily and frequently. It is more prevalent in the United States. And HIV-2, which is less transmittable. We have a longer interval between the virus and AIDS. And Western Africa is the primary site of infection for this type of HIV. Structural characteristics of HIV is it requires a living host to survive. It is genetically incomplete, so we have a T-cell lymphocyte fusion that connects the HIV to T-cell co-receptors. We also see entry inhibitors with the development of a new category of anti-retroviral drugs. We see replication enzymes with HIV. We have reverse transcriptase, which copies the viral RNA to the viral DNA. Integrase incorporates that viral DNA now into the host cell DNA. And protease frees that replicated viral particle into the cytoplasm of the cell. HIV is transmitted through body fluids such as blood, semen, vaginal secretions, and breast milk. High risk factors for contraction of HIV includes unprotected sexual intercourse, multiple sexual partners, sharing of IV needles, a non-autologous transfusion, in other words, a transfusion from a donor, and an infected mother to infant transmission. Prevention strategies include abstinence from sexual intercourse, avoiding casual sex with multiple partners. Make sure you use a condom or spermicide that includes non-oxynol 9. Abstain from using IV drugs that contribute to disinhibition and hypersexuality. And bank autologous blood or the self-donated blood or use directed donor blood. Nurses need to use standard precautions and report any needle sticks or sharps injury. This is how healthcare workers get HIV. So your mnemonic for HIV or AIDS. A client with AIDS indicates that more teaching about the condition is needed when the nurse hears which of the following statements. That will be B. I'm afraid to touch anyone. I might give them my disease. Remember, it's not spread by casual contact. AIDS is the end stage of the HIV infection. Criteria to be diagnosed with AIDS: we have a markedly decreased T4 cell count. And we also have development of certain cancers or opportunistic infections. There are different classifications of AIDS. We have category 1, 2, or 3, and category A, B, or C. AIDS impairs the ability of infected T4 cells to recognize foreign antigens, and it stimulates the B cell lymphocytes. The rate of progression is dependent on the concentration of the virus in the blood, the subtype and strain of HIV, and the status of the co-receptors on the CD4 cells, and effective drug treatment. These clients may have acute retroviral syndrome, which can be mistaken for the flu, fever, swollen and tender lymph nodes, pharyngitis, rash, muscle and joint pain, liver and spleen enlargement, weight loss, Kaposi sarcoma, which is a type of connective tissue cancer, pneumocystis pneumonia, and abnormal pap tests or pelvic inflammatory disease. Different tests that can be done include the ELISA test, the Western blot, and a total T cell 4 count. A viral load, which is a P24 antigen test, polymerase chain reaction. This will help guide drug therapy and the progression of the disease. And other cancer screenings include Pap and cervical tests. A client with AIDS is unable to cough because of weakness and fatigue. So this client is going to be at risk for ineffective airway clearance. We're going to treat AIDS or HIV with anti-retroviral drug therapy, which targets the viral enzymes, and highly active anti-retroviral therapy, otherwise known as HART. These drugs can include the nucleoside reverse transcriptase inhibitors, the non-nucleoside reverse transcriptase inhibitors, the protease inhibitors, and fusion inhibitors. Adverse effects of these medications include nausea, vomiting, diarrhea, pain, bone marrow suppression, rash, seizures, etc. With the protease inhibitors, we also see lipid abnormalities. There are numerous drug reactions with these medications, so very important to make sure that you're looking at this prior to administration. Problems with treatment include drug resistance and drug cross-resistance. Treatment includes CD4 count, pregnancy, HIV-associated renal disease, and hepatitis B. Drug therapy goals are going to be to keep that CD4 cell count above 350. We hopefully will see undetectable viral load levels. Adjunct therapy can include hydroxyurea that's used to treat cancer and cytokines to stimulate the production of lymphocytes. There are clinical trials of AIDS vaccines going on, and there are some medications that can help decrease the risk of contraction of HIV. Complications include opportunistic infections. Remember, this is attacking the T4 cells, which is part of the body's normal defenses in helping prevent infection from spreading in the body. Some of those opportunistic infections include that pneumocystitis pneumonia, mechanical ventilation, aerosol therapy, deep suctioning. We may see it treated with Bactrim or Septra. Candidiasis, or those yeast infections, or Candida albicans is another yeast infection. Another opportunistic infection is cytomegalovirus, or CMV. This can cause blindness, ulcers in the esophagus, colitis, pneumonia, and encephalitis. Cryptosporidiosis is a protozoan, causes diarrhea that leads to dehydration and electrolyte imbalance. This is another opportunistic infection. So stool testing for ova and parasites is very important. We may also see a complication of AIDS dementia complex, or ADC, where we see a degeneration of the brain. It will affect the mood, cognition, and motor functions. And distal sensory polyneuropathy, or DSP. These clients will have abnormal sensations, burning, and numbness. Very important for nurses to provide health teaching. HIV prevention strategies, such as the sexual abstinence or safer sex practices, diagnostic screenings and counseling, anti-retroviral drug teaching and teaching of any complications, etc. Support group and resources and referrals. Reduction of occupational risks, which include the standard precautions. So safe handling of needles and sharp instruments, transporting specimens of body fluids in leak-proof containers, cleaning and disinfecting utility gloves, removing barrier garments, and client teaching of that medication regimen and goals, how to maintain or gain weight, fluid intake, reporting weight loss, avoiding exposure to people with infections, daily baths, frequent rest periods, and not sharing IV needles, or they should never donate blood. So a client with AIDS is at risk for imbalanced nutrition related to anorexia, nausea, or mouth sores. Nursing interventions that may help alleviate symptoms that interfere with intake or nutrient use include all of the following except this includes restricting fluids to promote ease of swallowing in clients with oral ulcerations. We need to encourage fluid because these clients are going to be at risk for dehydration. And ethical issues. There are financial and insurance implications with the fear of disclosing their HIV status. Maybe it will affect their employment or health insurance coverage or even housing. And viatical settlements can name a person as a beneficiary to a life insurance in exchange for immediate cash. This is often done by an attorney or licensed insurance broker.